Good morning, and thank you for attending. I'm joined by Andrew McClellan, Director of COVID-19 Immunization Strategy, who will speak about the COVID-19 vaccine rollout, and Dr. Carol Zimbalati, Public Health Physician, to provide an update on the local COVID-19 situation. Over the past week, the province announced further restrictions coming into effect, and the province-wide emergency orders have been extended until May 20th. Provincially, we continue to see case counts of COVID-19 over 4,000 a day and intensive care units overflowing. The only way we're going to be able to lower the case numbers across the province is by continuing to follow public health measures and staying home. We recognize that cases in our district are some of the lowest in the province, and we want to see these numbers remain low. As of April 19th, our district had the lowest cumulative rate per 100,000 population in Ontario. I want to acknowledge the continued efforts from everyone in the district. However, know that now is not the time to let out our guard. We have to be vigilant. Much of the spread we are seeing is within and between households. People having family and friends over for a visit or going out to visit others themselves. You might think it's okay, but it isn't. Please remember to keep trips outside the home to essential trips only, such as going to work, getting groceries, attending a medical appointment, and being vaccinated. Following these measures and being vaccinated are the key actions that will get us back to normal. Each individual has a role to play. By each doing our part, we have the power to make a change by keeping case numbers low to protect everyone around us. With that, I would like to hand it over to Ms. McClellan to provide an update on our vaccine rollout this week.
Thank you, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we have provided 33,012 vaccinations in our district. 1,655 of those doses have been administered at local participating pharmacies. We now have over 30% of individuals 18 years of age and older in our district that have received their first dose of COVID-19 vaccine. By the end of this weekend, we will have completed the chronic home care recipients from phase 1 and have begun to identify and immunize homebound patients who are not receiving home care services. We continue to work our way through the phase 2 priorities as defined by the Ministry of Health, including special education workers, individuals with highest risk chronic medical conditions and their essential caregivers, as well as individuals who live in high-risk congregate settings. There is currently a lot of demand for vaccination as more groups become eligible. We want to reassure the public that everyone who wants a vaccine will get one, but we also have to follow the Ministry of Health's directions in the rollout of the vaccines and are limited by the supply that we receive. With such a high demand from individuals wanting to be vaccinated, our phone lines continue to experience higher than usual call volumes. We strongly encourage those who are able to book their own appointments online to do so. That'll free up the lines for those who need assistance and are unable to book online to reach our call center in a timely manner. We thank the public for their patience and understanding. If you wish to book an appointment for your vaccine at a pharmacy, please contact the pharmacy directly. The health unit doesn't book these appointments. We also want to remind the public that immunity from the vaccine does not build overnight. Individuals who are vaccinated need to continue to follow public health measures, including wearing face coverings, practicing social distancing, avoiding touching their face, nose, and eyes, and washing their hands frequently, and adhering to the stay-at-home order. It is also important to remember that in order to be protected, individuals need 2 doses of the vaccine. While the percentage of adult population who has received at least 1 dose of vaccine increases, only 1.8% of our residents in our district are fully immunized as of last evening. And now I'll turn it back over to Dr. Chirico.
Thank you, Ms. McClellan. Now to Dr. Zimbalati for an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we had 7 cases, bringing our total case count to 333, with 211 in the Nipissing district and 112 in the district of Parry Sound. As of this morning, we have 12 active cases. 6 of the active cases have screened positive for a variant of concern. To date in April, we have seen 40 cases in our district compared to 30 cases for the entire month of March. As of Friday, April 23rd, all 3 recent school cases in our health unit, which includes Silver Birches Elementary School, Our Lady of Sorrows Catholic Elementary School, and Whitewoods Public School, will have been deemed resolved, which means that individuals considered high risk are no longer required to self-isolate. No in-school transmission was observed with any of these cases. As Dr. Chirico stated, we continue to encourage everyone to follow public health measures, which is our best line of defense to stop the spread of COVID-19. With that, I'll pass it back to Dr. Chirico.
Thank you, Dr. Zimbalati. So this concludes our prepared remarks, and we'll now begin answering questions. So if you have a question, please type them into the Q&A at the top of the screen, and our moderator will read them out loud. And we'll try to get as many done as possible. And when possible, please ensure that your name's attached to the question. Thank you. So Alex, could you please read out the first question?
Perfect. Our first question is for Dr. Chirico. It comes from Alana Pickrell from CTV. Hospitals are being directed to cancel non-emergency surgeries in order to clear space for potential COVID-19 patients. Do you have any thoughts on this? Is it something that is needed in the North Bay area?
Well, currently, certainly all the hospitals are on alert for a potential of transfer of patients. We have, because we've been able to keep our case numbers low within a district, we have not had to reduce our surgeries currently. But I think that it's really important that people recognize that this can change quite quickly, and that it's up to each of us to do our part to help keep this system running the way it is, so that we all have access to these very important care and emergency department and ICU and all of the other services that the hospital provides. So we each play a role in doing that. And currently, we are not having to cancel surgeries.
Thank you. We have 2 questions that are asking the same thing, so I'm just going to read them both off, and they'll be both directed to yourself, Dr. Chirico. So the first is from Eric Thompson. Do you agree with the restrictions the Ontario government put in place last Friday? And then the same from Greg Bowman. Do you agree with the province's decision to close outdoor recreation with the exception of playgrounds? What evidence is there for the risk of transmission while playing golf or tennis? Is there a scenario where the amenities could open locally?
I think it's really important that people use good judgment, whether people agree with certain decisions that are made or not. Now is not the time, I think, to be dwelling in the past, but really look forward to the future and what we can do to change things. We have to use good judgment. One of the things that we do know is that being outside is the best way to certainly reduce the risk of transmission, being in the fresh air, and people need to use good judgment. So yes, getting out and exercising is very, very important to do for mental and physical well-being, but people need to do it in a way that's so you can do it with people within your own household to go to areas that basically you want to reduce the risk. So we know that the risk of transmission increases when you're around other people. So follow the public health measures, stay 2 meters apart, use your face coverings when appropriate. And I think that when people do that, we really can reduce the risk of transmission, slowing the spread, keeping our healthcare system functioning well, and as well, we can enjoy each other and get the physical activity that we need.
Thanks. Our next question is also for Dr. Chirico. It comes from Brad from Moose FM. Dr. Chirico, do you believe sacrificing Northern Ontario's vaccine shipment could help calm the storm in Southern Ontario and help our province-wide situation? Have Northern Ontario health units thought of making such sacrifices?
I think it really has to be a combination of both. I think that what we're trying to do is get everybody vaccinated as quickly as possible. But I think the important thing to remember is that we are not going to vaccinate our way out of this third wave in the near future. We have to follow the public health measures. We can't get everybody vaccinated in time to do that. But part of the plan certainly is to get people vaccinated. I think there has to be a certain allotment of vaccine to everybody, all the health units. But I also think we have to be very understanding and recognize that there are areas where the healthcare system are being overrun and that there are hotspots. There are certain populations that are much more vulnerable. And I believe that, yes, the vaccine needs to go to them as well. So it's a balance. It's a combination of both.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Those who have received one dose of the COVID-19 vaccine, are they guaranteed to receive their second dose? Is the second dose being stored locally?
No, the second dose is not being stored locally. Second dose allocations will come as we move through the first dose. Vaccines are currently being administered as first doses, with the exception of those people who qualify for a second dose under the ministry's guidelines. And are we guaranteed a supply for the second dose? Our supply will be completely dependent on the supply of vaccine coming into the federal government and distributed throughout the provinces.
And I'd like to add too, Andrea, that certainly the strategy has been, because there's been a shortage of vaccine, is to get as many people vaccinated as quickly as possible. And to do that, we have to do wide distribution. We have to try to get everybody a first dose. And so that's the rationale behind it. And eventually everybody will get the second dose that they require.
Thank you. Our next question is for Dr. Chirico. It comes from Clark from Cogeco/YourTV. Good morning. Paid sick days were considered by, or are being considered by Premier Doug Ford. How important is this to allow workers living on fixed income the ability to take time off to get tested if they feel unwell to prevent the spread?
Yeah, that's a very good question, Clark, and thanks for raising that. And we certainly do advocate any measures that can be taken to help reduce the spread. And when people feel that if they have symptoms or they need to be tested, that they can take the time off and still support themselves and their families. So anything that will help that, we'll certainly advocate for that.
Thank you. Our next question is for Dr. Zimbalati. It comes from Jennifer from the Nugget. Does the health unit have any idea when local schools could return to in-class learning?
Thanks, Jennifer. At this point, it is too early to say when we will be able to return to in-school learning. It does depend largely on the provincial trends, which we continue to monitor, and will depend somewhat as well on local trends. Largely, this is a provincial decision, but if we see that the provincial numbers are decreasing and our local numbers are very low, then we will advocate for return to in-school learning when it is safe to do so.
Thank you. Our next question is to Dr. Chirico. It comes from Mo from My Parry Sound Now. Good morning and happy Earth Day. So when you say the district has the lowest cumulative rate of new cases in Ontario, please correct me if I got that wrong, what would you say the North Bay Parry Sound District Health Unit area has done differently than, say, Simcoe or Peel? What is the key to controlling these numbers like we seem to be doing decent at since the start of 2021?
Yes, thank you for raising that, and it's a very good question. I think there's a combination of a lot of factors. And I think that I would certainly love to believe, and I do believe, that people are adhering to the public health measures. And people, I think, have sacrificed a great deal. And that's helped to keep the case numbers low. I think that also you're never going to know for certainty exactly what the reason is. But I also do believe that it has to do with our demographics. We have an older population. We have rural areas, more space. I think there's less population density. The travel patterns as well may be certainly different. And I also think that we do have within our district different workplace sectors. And that we know has contributed to that. I also think that it was important that when we first had VOCs in our district, that we were able to advocate and remain in shutdown with a stay-at-home order. I think that significantly contributed to us being able to limit the spread of the VOCs. So that was significant. And I think that moving forward, similarly, we can continue to keep case numbers low, but it's going to take everybody to do that.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah from the Perry Sound North Star. Is the high demand for a vaccine a bright spot during this pandemic, and was it expected?
I think it has been an incredible scientific breakthrough to use the modern technology to get to the situation we're in now. When you consider last year at this time, we didn't even have a vaccine on the horizon, and what they were able to do is astonishing. And I think it is a real step forward, not just for what we're dealing with now, but also for the future and the technology that has come into being. We're able to produce vaccines that in the shortest amount of time that we've ever had been able to do it in history. There's much to learn, but we're in a much better place right now. And I think that it's been a real, I think that having this vaccine and the demand that we currently have really speaks to how important vaccines are, how safe they are, and how effective they can be. So I think the future is very bright when it comes to the whole vaccine industry and how it can protect populations.
I'm just, if I could just add to that as well, that with this vaccine, we haven't seen the level of vaccine hesitancy that you often see in a new vaccine that comes out. And so I think that's been a really bright spot as well, is that people are confident and trusting that this is something that will be helpful to us. And so I think that speaks to the uptake as well. And so it's made things much easier. I'd much rather have to deal with an over demand than an under demand, and have trying to convince people that this is the right thing to do. So that's certainly been very positive.
Thanks. Our next question is for Dr. Zimbalati. It comes from Sarah from the Perry Sound North Star. Will you or are you pressing the province to reopen schools in this region?
Thanks, Sarah, for that question. At this point, I don't believe that that is the right direction to be going. The case counts provincially are still very high, and we need to have control provincially before we would advocate for a return to school in our area. Because as we've been repeating over and over again, we aren't an island, and what happens in the rest of the province does affect us. And so we need to make sure that we keep our numbers low and we stay safe here, so that the rest of the province can also do what it needs to do to reduce their numbers. So when it appears that provincial numbers are much reduced and under control, and the same thing can be said in our area, then that would be the time that it is to enter into those conversations.
Thanks.
But it is a provincial decision.
Thank you. So the next question is also for yourself, Dr. Zimbalani. It comes from Jennifer from the Nugget. Why would provincial numbers have an impact when it comes to students returning to the classroom?
That's a good question too. I understand, a lot of the other measures that we've put in place locally, they have been to prevent travel, for instance, between certain jurisdictions, and that doesn't really apply to in-school learning. However, we need to be able to keep our case numbers low in the district so that we have the capacity that our healthcare system has the capacity to work with the rest of the provincial healthcare system to be able to control numbers and get and make sure that all Ontarians have access to healthcare. And closing our schools and keeping everyone safe in the community here is part of that strategy.
And I'd also like to add too that the quickest and the best way to get our kids back into school is by keeping our community spread low. And if we can do that within our community and everybody work towards that goal, we will see return to classroom much quicker.
Thank you. This question is for Dr. Chirko. It comes from Stu from Bay Today. How do you compare the dangers of golf to the safety of cross-country skiing? They are both outside activities with common areas such as parking lots. Why the distinction?
I think that what we need to understand is that it's not the activity itself that's an issue. It's everything that surrounds it. And it can be controlled. You can have situations where you're reducing the risk. And if the public health measures are being followed, first of all, that people aren't traveling from out of district or from other parts of the province to partake in that kind of a sport. They're not traveling in the same car with their buddies. They're not congregating in parking lots. If they do it wisely, it can be a very safe sport to take part in. But when it gets abused and they're not following what they need to be doing, it puts everybody at risk. And that's the problem, not so much the activity itself.
Thank you. Our next question is also for you, Dr. Chirko. It comes from Jennifer from the Nugget. Are you concerned about the double variant, and do the present vaccines offer protection?
I'm sorry, I missed the part about the variants. Could you repeat that, please?
Are you concerned about the double variant, and do the present vaccines offer protection?
I think it's really important that, first of all, the best protection is going to be following the public health measures, and that people do adhere to the 2 meters, do adhere to the face coverings and washing hands and sanitizing. The variants of concern have been shown to be susceptible to vaccines, some more than others. And what we do know is that the vaccines are very good in helping to prevent serious illness and admissions to hospital, and effective against the most severe outcome, certainly, which would be death. So yes, they've been very good to help with those. The other thing is that the pharmaceutical companies producing them have measures in place that they can adjust the vaccines because of the new technology to help direct it against variants when they do arise. But currently, they are effective against severe disease and hospital admissions, which is exactly what we need.
And I'd like to add to that, just saying to reiterate how important the public health measures are, because the fewer circulating cases we have of each variant, the less chance there is of the development of further double variants. So we need to keep the case counts low to decrease that risk.
Thank you. Our next question is for Dr. Chirko. It comes from Eric Thompson. You say people need to use good judgment, but we know that these latest restrictions are not based on any evidence or recommendations from the Science Advisory Table. Would you say our province is using good judgment?
I really don't believe that this is the time to be blaming other people, blaming perhaps controversial decisions that have been made. I really think that we need to work together. People understand what they need to do. And what they need to do is to follow the public health measures, to be able to use good judgment, to be able to put themselves in situations where they reduce the risk. So follow the measures of staying at home, not having people visit, not going out to visit, only going out for essential reasons. I think if people do that, despite they may feel that some of the decisions that have been made are controversial, they may, to some people, feel that they may not have made a lot of sense, but we do know what we need to do, and it'll work. We did it in the first wave. We were successful in slowing the spread and reduced everybody's risk. We can do it again, and that's what we need to do for the third wave to get to the other side of this.
Thank you. Our next question is for Dr. Zimbalati and comes from Jennifer from the Nugget. It's a follow-up to her previous question. When speaking about those low cases, so what would those low case numbers have to be to reopen schools? The North Bay Parry Sound District Health Unit district has among, if not the lowest number of positive cases in the province.
Certainly our case counts are low here currently, but they are higher than they were in March, as we've seen. But I think the more important factor to consider right now is the severe pandemic, the severe numbers that we're seeing in the rest of the province. And now is not the time to be entering into those conversations.
I'd also like to add to that too, what Dr. Zimbalati says, and to reinforce it, is that there are a number of different indices that we're going to look at. It's not going to simply be just the case count. I think we have to look at trends, and trends not just within our district, but throughout the province as well. And there's many indices that would come into play, and you can't just isolate one and say, as soon as we reach this number, we are going to move back into the schools. I think we also have to be very careful and look at our healthcare system, the acute care system, the hospitals, public health capacity as well, not just here, but elsewhere too, because it all impacts, we're all interconnected. So it's not going to be just one indice or one case count that when we reach it, we will move back into schools. Lots of factors.
Our next question is for Dr. Chirko. It comes from Mo from My Parry Sound Now. Earlier this week, Parry Sound Golf and Country Club's president sent a letter to the Premier respectfully calling for golf courses to be allowed to open under Ontario's stay-at-home order. Quote, golf can be played safely, end quote, the letter said, citing 2,000 plus infection-free rounds of golf safely played last year under the public health restrictions. What do you think about this? Many organizations are calling for golf to be allowed now, and I can't help but compare it to playgrounds that were recently reopened.
I think you can make a very good case for it. The decision is ultimately going to be up to the Premier to decide on what they wish to do. And like I mentioned before, there are many sports, there are many things that you can do safely, but it's all the other things surrounding it. And if people do it as they're supposed to be doing, then yes, there is potential for that to happen. But it is the Premier's decision to make, and we'll just have to wait to see what they decide to do.
Thank you. Our next question is also for Dr. Chirko. It's from Jennifer from the Nugget. Do you expect those who receive a COVID-19 vaccine to receive a yearly booster shot?
Thank you for that, Jennifer. That's a really good question. And I think the answer to that is that ongoing studies will ultimately determine whether or not that is required. And as we know, I mean, this year has been certainly a lot of learnings, and they're continuing to doing research, and they're continuing to monitor, because there's still lots of unanswered questions. And one of them is certainly how much immunity is required in order for us to be protected. How long is that going to last? And will we need another booster? And by doing those studies, and they continue to do them, and it may vary between vaccines, we don't know. But what's really positive is that we've got enough different choices of vaccines to be able to work together to figure that all out. I suspect that we likely will have to have a booster of some sort if history repeats itself, similar to what we see with the flu vaccine. So it's very possible it could happen. I can't say for sure, but I think that the research will eventually be able to tell us that.
And maybe I'll just add to that in terms of, for example, the flu vaccine, it's not necessarily that it's a booster all the time to the same variant. There could be different strains. So that's something that is continuously being monitored to make sure that the vaccine and the immunity in the population, which is conferred by the vaccine, is matching if they're matching circulating virus, if there is circulating virus.
Thank you. Our next question is from Stu from Day to Day, and this would go to Dr. Zimbalani. Do you believe teachers should be vaccinated before they return to school?
I mean, I think there are so many essential workers that require vaccination as well, and we do have a limited supply. So in an ideal world, we would get everyone vaccinated as soon as possible. But that may not be possible. So we'll just have to wait and see how the numbers and the indices play out in terms of indicating when a return to school might be reasonable, and see where we are with vaccination of the teachers. I don't necessarily think that it is the one indicator that might prevent return to school, but it's too early to say.
Thank you. So that completes our submitted questions, and that concludes our press conference for today. Thank you for everyone who attended, and the recording will be available on our website this afternoon. As well, we'll see you back next week at 10 a.m. Thank you.